Research suggests that those from certain population have higher suicide rates. How can we deal with this issue?
Well, suicide is tied to a lot of systemic issues, right? So anything that we can do to reduce systemic issues such as discrimination, marginalization, and lack of support will help address the underlying issues that lead people to feel the hopelessness and helplessness that come from suicide. And at the same time, as I keep on hammering on it, but being open and talking about it, reducing the stigma about it, because a lot of the time with hopelessness, people feel like it's a weakness that they can't discuss, and we want people to know that they can.
Yes. You hit the nail on the head there pertaining to the systemic issues, whether it's racism, discrimination. I think we don't think about the stress that those systemic barriers cause and how much it impacts one's health. I think sometimes we don't, as a society, we don't focus on that or recognize the impact, you know? Having these barriers removed is so key and so crucial. Which groups have the highest suicide rates, do you think?
Well, people who have a higher risk of committing suicide if they have serious mental health or addictions issues, if they have a family history of suicide, or if they've had previous suicide attempts. And like we said before, people who are from marginalized groups, people who deal with more kind of systematic stress and difficulty can have a much higher suicide rate than the general population.